Hi, my name is Ifazi Penrazan. My medical number is U424035, and today we're going to present about case study about colon cancer. First thing first, we're going to go to the introduction and the overview. What is colon cancer? Colon cancer is a malignant tumor that develops in the sigmoid colon, an S-shaped section of the larger intestine just above the rectum. You can see inside this slide, the picture inside this slide. Now we're going to go through the sign of and symptom of the colon cancer. Colon cancer have a 5 sign and symptom. First is trouble going to the bathroom. Second, blood in the stool. Third, abdominal pain and discomfort. Fourth, loss of appetite and weight loss. And lastly, explain tiredness. Now we're going to go to the case study. Now we're going to go to the detailed patient background. She is a 76-year-old woman and she's been diagnosed with a sigmoid colon cancer. She already been in 6 seconds inside the hospital. She has 5 pre-medication and 4 of chemotherapy medication. Now we're going through the family history. Her father has a hypertension, while the mother has a type 2 diabetes. She has 2 siblings. The brother has a hypertension and a heart disease, while his sister have a osteoarthritis and diabetes. There is no family history with the colon cancer. Now we're going to go through his lifestyle and habit. The past medication history show that he take a high intake of red meat and a processed meat. She also low in the fiber in her diet, while also poor sleep and chronic stress. She also is a really high smoking and drinking a lot of alcohol. When you go through her medical history, the past medical history show that she already have a inflammatory bowel disease, type 2 diabetes, obesity, metabolic syndrome, and the hypertension with the cardiovascular disease. That's all for me. Thank you.
As for the pre-medication, to control his side effects, she was given Granistron 3 mg, Controloc 40 mg, Piriton 10 mg, Dexa 8 mg, Maxlon 10 mg. Everything was given by drip, either by drip or by injection. The first pre-medication that she was given is Granistron 1 mg. This is to prevent her from vomiting when oxaliplatin enters her body. It blocks serotonin 5-HT3 receptors, preventing the serotonin-induced nausea and vomiting, while the side effect may induce constipation and headache. The pantoprazole is a proton pump inhibitor protecting the stomach line from irritation. Side effect may induce diarrhea or abdominal pain. Piniton helps reduce the allergic or hypersensitivity reaction during oxaliplatin infusion. This works by blocking the histamine H1 receptor, reducing the allergic reaction such as itching, but the side effect may include drowsiness or dry mouth. The dexamethasone is an antiemetic reduced inflammatory reaction. It suppresses the cytokines, suppressing the inflammation and immune response. Side effects may include insomnia, increased appetite, and weight gain. The Maxlon is a nausea and vomiting preventer. It blocks the D2 receptor, accelerating the gastric emptying. Side effects may include diarrhea and fatigue. For this patient, she has been given 2 cancer drugs, which is oxaliplatin and TS1. The oxaliplatin helps kill cancer cells, while the TS1 stops cancer cell growth. Now let's recap every drugs that has been given. Dexamethasone to reduce the inflammation, allergic reaction, and nausea from the chemotherapy drugs, while Granistron is to prevent nausea and vomiting caused by every drug. Controloc is to protect the stomach lining from irritation due to the medications given or from stress. Chlorphormine is to prevent the hypersensitivity reaction due to the chemo drugs. Now, two chemo drugs is called oxaliplatin and TS1. Oxaliplatin is to kill the cancer cells, while TS1 is to stop the cancer cell growth. The oxaliplatin will be diluted in dextrose 5% to 150 ml. The volume needed is 30 ml, meaning 30 ml in a 250 dextrose 5.